Hi, I'm Jessica Drummond with the Integrative Women's Health Institute. Today, I have for you not just a new tool, a new strategy for helping women with chronic pelvic pain, but an entirely new approach to your healing of chronic pelvic pain when working with even the most complex patients and clients. So today, I want to introduce you in this webinar to functional nutrition. It is what I believe the missing piece is for healing some of our most complex clients that are struggling with chronic pelvic pain, and not just the most complex. Sometimes it can be a tool for those who have simpler cases, and it may in and of itself be enough. So again, my name is Jessica Drummond. I'm the founder of the Integrative Women's Health Institute. And let's just jump right in, and I want to introduce this tool and this perspective to you today. All of us who work with women and men who struggle with chronic pelvic pain know that this symptom, this diagnosis, this syndrome can be a real challenge to overcome. It's extremely challenging for the patient or client. And as a clinician, you may feel extremely frustrated because, as clinicians, we work very hard to learn the most up-to-date science. We gather tools and strategies. We read the research. We go to training courses. We practice skillfully using our hands and our diagnostic brains and our, prescriptive minds. And sometimes, especially with this complex of symptoms, it's just not enough. And it can be extremely frustrating. I started my career as a physical therapist, and I spent about 12 years specializing in working with women's health issues and pelvic health issues. So I've seen thousands of patients with chronic pelvic pain. And about probably more like 6-7 years ago now, I began to explore, because of my own health issues, a new perspective of bringing functional nutrition, not just, the food pyramid and how many calories is your client eating, but a very root cause resolution based approach to a population that, sometimes I struggled with as a physical therapist. Sometimes my tools worked really well. Sometimes my approach worked really well. And often in combination, physical therapy and functional nutrition works really, really well. And I continue to practice that approach with many of my physical therapy colleagues. And so I want to introduce anyone who's working with women with chronic pelvic pain, whether you're an obstetrician, gynecologist, a nurse practitioner, a pain management physician, a physical medicine physician, a physical therapist, a nutritionist who maybe isn't working with this population yet, but we need you to learn this. There are many, many women who are not being well served yet from a nutrition perspective. So acupuncturists. So across the disciplines, this approach can be very useful. So you have the tools that you were trained in: physical therapy, medicine, surgery, acupuncture. And this also is a tool which can be added to, combined with your other tools. And as I said, it is a shift. It's a real shift in perspective. So, and it's called, as I said, functional nutrition. Essentially, what functional nutrition is the use of food and vitamin, mineral, and other herbal supplements to address a root cause loss of optimal functioning of various physiologic systems such as the digestive system, the immune system, the urogenital system, the neurologic system, the endocrine system, and also the gut microbiota, and also the vaginal microbiota, and the mouth microbiota, and the placental microbiota. The microbiota is the community of microbial organisms that essentially coexists with us. In fact, they're the dominant player if you want to start comparing numbers. Humans have, we have a microbial community, a community of bacteria, and probably also viruses. There's lots more new research coming out there. But the bacterial community has about 100 times more genes than we actually have human genes. So we're a community. Our physical body is made up of a community of a few human genes and quite a few bacterial genes. And so we have to work together commensally in order for the human to feel optimally healthy. So I include the microbiome as the microbiota, this community of microorganisms, as one of our systems as humans. It's also, so it's not just the, physiologic approach of optimizing biochemistry, of optimizing microbial balance, of optimizing mucosal health and endocrine balance, but also it's actually, as I said, an approach that's somewhat different from what I learned, in my more conventional medical training and practice from physical therapy school and working in hospitals and clinics for about 12 years. So the perspective is not one of reducing symptoms necessarily. It is one of empowering each patient, each client to own her healing journey, to really own it, and to nourish herself beyond the biochemical. So we do expect that symptoms will improve and resolve, but we're not targeting them necessarily. It's a focus on the wider perspective of what it means to be healthy, community support, pleasure, restoration, resilience, rest, mindfulness, connection with nature. As I said, we have no choice but to connect with nature. We have 100 times more microbial genes than we have human genes just walking around with us. So, you think of that as part of the environment, not to mention, the water that we rely on, the air we rely on, and so forth. Personal and professional development, and of course, biopsychosocial pain reduction strategies. So helping our clients really understand what pain means and strategies that they can use to reduce that pain by, changing how their relationship with their pain. So how does this approach help men and women that are struggling with chronic pelvic pain? Because the pelvis is this very unique bowl inside the human body, it houses the reproductive system, the bladder, the gastrointestinal system, and it's surrounded by a musculoskeletal system of bones and joints and myofascial tissue. And it's often the physical location where clients can hold fear, especially lack of safety, sensations of lack of safety, also anger and other emotions. It's a very unique area where a holistic approach to helping the client to optimize both her biological and emotional health, and additionally, her life and community health. So she feels safe, she feels supported, she feels empowered. She feels like she's making a contribution. She may be birthing things creatively, that sort of thing. So we think very broadly and holistically when it comes to the bowl of the pelvis, because physically and sort of otherworldly, it houses so much. So what will you learn? In this program, as I said, we're flipping the conventional approach of addressing symptoms with pain management tools upside down. What instead we're focusing on is optimizing the health of all systems that impact pelvic health, including those physiologic systems, of course, the emotions that may land in the pelvis, and community support networks. Based on my experience, that when a woman or a man's resilience and empowerment, in addition to their, feeling of physical resilience and the functioning of their physical systems are optimized, when all of that is improved, the symptoms are naturally reduced or relieved. The symptoms just melt away. Also, this approach is highly collaborative. Combining these tools with appropriate medicine, surgery, physical therapy, and psychotherapy may offer some patients even better results. The Integrative Women's Health Institute Student Body is comprised of a wide variety of clinicians from across the globe who thrive on collaboration. So as I said, whether you're a physical therapist, a coach, an acupuncturist, a physician, a nurse practitioner, a nurse midwife, you are in the right place. We have nutritionists, we have fitness professionals, and we span more than 25 countries now. So you will be highly supported, and there are lots of collaborators to support your journey of improving your ability to work with clients with the most complex pelvic health concerns and those that have less complex but still extremely important pelvic health concerns when it comes to their own lives. So what does this program include? Well, first of all, Module 1 is an introduction to functional nutrition. I gave you a very short overview of what functional nutrition is here today. We're going to go deeper, and I really believe that functional nutrition is best learned by experience. So there is going to be a clinician experience where in that first module, you will start to understand this perspective by applying it to your own health and your own life. I feel like one of my big missions at the Integrative Women's Health Institute is that I feel that the healthier our clinicians are who are working with populations of women with all sorts of complex health concerns, the easier it is for us to help them to heal. Module 2, we're going to dig into optimizing the gut and both the intestinal microbiota and the vaginal microbiota to support the minimization of pain. So in this module, we'll be looking at functional nutrition strategies to address digestive issues like constipation, IBS, inflammatory bowel disease, and more, because these are known significant contributors even when the client with pelvic pain's primary concern is something more in the reproductive realm or the bladder realm. Because these organs are housed in that bowl, there is what we know to be called organ crosstalk. So very often someone with endometriosis, for example, will also have painful bladder syndrome, or women with constipation will struggle with some other kind of reproductive pain. So when there are painful syndromes in the bladder, in the reproductive organs, in the pelvic floor, muscles, joints, other soft tissues, and the gut, so the large intestine, the colon, all of these things play off of each other, and often minimizing constipation, for example, will help to minimize bladder pain. So again, we look at this as an entire complex, but supporting digestion first will help minimize some of the other organ systems' contributions to that pain level. So we can start bringing the pain down right away, which is, of course, always helpful and motivating for both us and our patients and clients. Next, we'll move on to optimizing immune health and reducing chronic inflammation. We, of course, understand now through the biopsychosocial model of pain, perspective on pain, that inflammation is not the only cause of pain. It's not a one-to-one cause of pain. It doesn't tell us anything necessarily about intensity of pain, but we do understand, again, from research across different so-called conditions like painful bladder syndrome, endometriosis, and so forth, that when there are these longstanding pain issues, often we do have elevated inflammatory cytokines, elevated inflammatory markers. And so reducing those with a wide variety of strategies, and food and supplements are a really useful strategy in this area, can again work towards optimizing the system and allowing the symptoms to melt away. And the next module will also talk about something that's very related to that, which is the pelvic pain elimination diet, which we've developed here at the Integrative Women's Health Institute based on a review of the available published literature. Then we'll talk about genetics and epigenetics, because there's some really fascinating emerging research on the potential impacts of various genetic SNPs and how they, can play out depending on a person's lifestyle and diet on chronic pelvic pain. Also, we'll be talking about nutrients, neurotransmitters, and the nervous system, a really, again, wide lens, holistic approach on mind-body nutrition to support quieting the pain response when it has to do with the nervous system and potentially with nutrient deficiencies. We'll also be talking about hormones. So again, in the pelvis, the reproductive system is alive and well, and, optimally balanced adrenal hormones, thyroid hormones, and sex hormones can really support pelvic health throughout the lifespan. Often we work with women who are in transitions. They may be postpartum or in perimenopause, and looking at hormonal shifts can make a big difference to those populations in particular. Additionally, we'll be diving into how to improve the detoxification system to support pelvic health. Every single one of us is exposed to quite a number of chemicals now in the environment. And not only that, but, we have to be able to break down, for example, estrogen. Certainly estrogen is a big player in pelvic health. And if our liver function is not optimal, not because, there's necessarily liver disease, but perhaps we're missing some support nutrients for the liver to be able to metabolize certain substances, including just, substances that we create in our own body, like, estrogen and other hormones, then it'll be difficult to optimize the levels of hormones and to support the metabolism of chemicals that we are exposed to in the environment. And women are exposed to far more chemicals each day than men because women use things like makeup and hairspray and body lotion and things like that, much more than men do. While our body has digestive, endocrine, detoxification systems, again, the approach here is using nutrition, both nutrients, supplements, food, community, sleep, movement, all of these different things to nourish those systems to function more optimally. And finally, I'm going to teach you some health coaching strategies that will, again, support this shift so that our clients, as they come into us, coming in to see us seeking reduction of their pain, begin to see themselves as the owner of their healing journey and really taking ownership of the lifestyle shifts that they can make to really optimize the functioning of all of these different biologic systems and even their more broader community systems, their work, their family relationships, their neighborhoods and communities. All of these things contribute to optimal health. So how does it work? Well, this is an online clinician education course. It is designed for busy women's health professionals and women's wellness professionals. And we have found that the online format is extremely effective. Essentially, what happens is you will register. We offer this course in classes, so you will register with a group who's signed up for the same time frame as you have. And so you'll get to know your class, which is a lot of fun in our private Facebook group. And we have tons of collaborations going on all the time among the students of the Integrative Women's Health Institute. Then on a practical level, you'll be getting emails once a week as soon as the program begins, which the dates for this session will be detailed on the page below this video. So you'll receive 8 modules of material, 1 per week in that private membership site. And anytime I add updates, new studies come out, we learn something new about this population, I learn something new clinically, we have more resources to provide for you to help you, such as e-cookbooks or, patient assessment forms or anything like that. Once you've registered for this program, if there are new updates like that, they will be added to the membership site, over time, and you will still have access to them well into the future. And then you will meet your class in our private Facebook group, and we'll have one live Q&A session with me and myself, and many of the other faculty members at the Integrative Women's Health Institute are very often in that private Facebook group answering your questions day in and day out. So, and if you can't attend the live session, we always give you an option to submit your questions in advance. We answer them and then give you access to the recording. So you might be asking yourself, am I, Jessica Drummond, qualified to teach you this? And I hope you will find that the answer is yes. I've been an invited speaker at top conferences for pelvic health professionals, and this is the topic that they always want me to speak on. I've been invited to speak at the American Physical Therapy Association's Combined Section meeting, which is a large physical therapist conference that happens once per year. I've been invited to speak at the International Pelvic Pain Society meeting, and I've been invited to various pelvic pain clinics all over the world. All of these things have been great experiences, and this is essentially the big key topic that they always want me to speak on. Additionally, I've been an invited guest on many major podcasts, including The Pelvic Messenger, Couch Talk with Dr. Anna Kabecka, The Future of Healing, which is an online conference presented by the Institute for the Psychology of Eating, the Healing Pain Summit, and many, many more podcasts, radio interviews, guest blogs, things like that. Finally, my academic and sort of traditional credentials are that I have a master's in physical therapy from Emory University. I have over 12 years of pelvic physical therapy experience. I've spent 5 years running an integrative practice in functional nutrition and coaching for pelvic pain and other women's health concerns here at the Integrative Women's Health Institute. And I've been teaching professionals for about 3 years now. I'm also a doctoral student in functional nutrition, and I'm the author of Functional Nutrition for Pelvic Pain, which is a chapter in the upcoming medical textbook, Healing in Urology. More importantly than my, street cred is that you can apply this material immediately. This is designed, again, for working professionals. You're going to take this content, you're going to take the tools, and you're going to take the perspective. You're going to have multiple ways to learn this and practice it by looking at the webinars. You'll have printouts of all of the slides. You can take notes and practice. You'll have the ability to ask questions every day of the course if you want to in our private Facebook group. Everything that you'll learn, you can bring to your practice immediately to build on what you're already doing to get even better results for your clients and patients. And, one of the other really important things about this course is not only will you have more tools for your clients with pelvic pain, but you'll likely find that the perspective shifts that you'll have as you shift from the goal of symptom reduction, each time you meet a new client, to supporting the optimization of her health, every system in her body and in her life, will actually reduce your own stress and your overwhelm, even when it comes to the most complex clients, because you're going to be showing your clients what they eat, how they sleep, what they're thinking about, who their support networks are, what kind of work that they're doing, what vitamin and herbal supplements that they're taking. Each of these things has an impact on optimizing their overall health, and they will be more and more confident to step into the driver's seat of owning their own healing journey, which is really important because at the end of the day, when we're talking about lifestyle shifts, including nutrition, we can't go home and eat for our clients, right? If we could, it would be so much easier. Except I don't know how many clients you could take at that point, but let's assume you could go home and eat for your clients. Well, you could just eat what they should eat. But there are so many factors, as we know, that go into those day-to-day decisions of what to put in our mouth 3 times a day or more. So the more our clients take ownership of this, the stronger they will be getting in terms of owning their entire health journey. And again, that really can reduce your stress and overwhelm because your clients will be so much more empowered And it's really an exciting feeling, both for you, but also for them as well. So below this video, the page describes all of the nitty-gritty about the registration dates and how long this session is and when it begins and, all that kind of stuff. And if you find you have more questions that are not answered on the page below, please don't hesitate to email my assistant. She is wonderful. She's great. At support@integrativewomenshealthinstitute.com or visit our website, integrativewomenshealthinstitute.com. Thanks so much for being here. Thanks for your attention. And I look forward to seeing you in the program and in our private Facebook group. Have a great day.